Hello everyone and welcome back. A few people asked how to fill these conservative accesses, so I made a quick video on obturation for very small accesses. As you can see from the preoperative images, this tooth was completely virgin with no caries or existing restorations. He had a history of trauma and that's why the tooth died. So I did a conservative access here using just the EG3 burr, which is less than a millimeter in diameter. I ended up doing the traditional 1704-2006 shaping for it, as you have seen in my other videos, and as the case had some drainage and he was in a lot of pain, I placed calcium hydroxide. One of the first things you must consider when temporizing small accesses is how hard it is to get cotton pellets or sponges out of them. Trust me on this one. I ended up not using anything to cover the calcium hydroxide and only used a small amount of Cavit. I'm not concerned about where in this case because the hole is so tiny and the chance of this patient causing any damage or dislodging it is pretty much zero. When he returned after a month, he was completely asymptomatic, so I will show you how we clean this out and finish the case. The first thing is to remove the Cavit using the same burr, so we used an EG3. Then we go through the process of final rinse. In this case, I used bleach, EDTA, and isopropyl alcohol with a round of the endoactivator in between to dislodge any remaining calcium hydroxide inside. Start using your dry paper points to ensure everything is nice and clean inside. And in this case, I'm going to use the squirt technique. If you're going to use warm vertical or a single cone technique, I would recommend a few things. First, be careful with how much sealer you place inside the canal, as any excess sealer you'll have to remove will be far more difficult with a tiny access like this. The second is when you do your down pack with whatever unit you like, try to find a tip size that is very close to the existing size of the canal. That way you don't have excess gutta percha going up alongside of that heated tip and getting stuck to the wall. Instead, you want to have a clean cut. If you do end up having excess gutta percha, or if it's stuck inside, I've shown in the past how to use headstroms to remove excess gutta percha, which will be your best option. Here though, we're going to use the squirt technique, and after placing the sealer using a cone down to length, I always recapitulate using a 20K file. Then we're going to use the obturation unit. In this case, it's the beta unit from B&L. You do want to use the smallest tip in this case, so I used a 25 gauge. I'm not going to obturate the whole canal at once either. I want to do it stepwise so I don't have excess gutta percha to clean out. After you do your first increment of gutta percha, take your smallest plugger, in this case I'm using the B&L 35 condenser, and condense as usual. After you pack that down, use the backfill unit again. Let the gutta percha push you up to where the CEJ is. Then go in with your condenser again, rinse with isopropyl alcohol to remove any excess sealer like normal, and then in this case I ended up using the PacMac not only to help condense the gutta percha, but also to control where the coronal aspect ends. Usually, when you use a PacMac, you want to brush it along the wall as you remove it, which, as it's spinning, will push the gutta percha down inside and off of the file. What I did differently here is I didn't go against the wall. Instead, I put the PacMac down like normal, and as I'm pulling back out, you can see it pulls out the gutta percha nicely with it. Pack that down with your condenser, ensure you're at the CEJ where you want to be, and this is what it looks like. So clinically, it'll be very straightforward for his dentist to seal this back up. His dentist likes to see these patients back for any restoration, so I place Cavit as a temporary, no sponge or cotton as we just talked about. In this case, there's no need for a crown whatsoever because we're able to keep the access so conservative. Here's the final x-ray. I'm happy with this. The gutta percha ends right at the CEJ, so I'm not worried about any staining or issues in the future. Thank you again to my audience for suggesting this as a topic. I read and respond to all the comments, so drop a comment below with what you'd like to see next. Whatever you're interested in seeing, this is what I want to make videos about. As always, please drop a like to let me, and the algorithm, know you appreciate videos like this, and subscribe so you don't miss any videos in the future. As always, thank you so much for watching, and I will talk to you next time.